Welcome to Soar Massage and Manual Therapy. The purpose of this video is to discuss neuromuscular therapy and its role in treating soft tissue pain and dysfunction. Basically, when you think of neuromuscular therapy, we look at the body from 5 different principles to help treat soft tissue pain. The first principle in neuromuscular therapy is to always evaluate the posture. Posture may play a role in why you have pain and why your pain is not going away. So one of the things we'll do is evaluate your posture and compare it to the skeletal chart to see how well your muscles and bones are working in conjunction with each other. For example, if your ear is over your shoulder, the cervical spine is in alignment to support the weight of the head. If you have a forward head posture, then a lot of times those muscles in the back of your neck are going to be overstrained and causing pain or keeping your pain from alleviating. So posture is number 1. Range of motion is number 2. What we want to see is how well do you move through a normal range of motion, which muscles are involved, which soft tissues are involved, and why you can't move your head and turn your neck fully to look when you're backing out the car out of the driveway, or looking when you're turning into a parking space. So number 2 is range of motion. Number 3, we talk about ischemic muscle. An ischemic muscle is basically the part of the muscle that's so tight that doesn't allow blood flow into the muscle, bringing nutrients and oxygen in, and carrying metabolic waste out. So when we treat a patient, we're always looking for where the muscles are tight and restricting proper blood flow and proper range of motion. Now, one of the things we have to understand is neuromuscular therapy is a very precise and specific treatment. We never want to cause more pain to a patient when we're working on them, so we always look to be specific with the muscle work, not just going deep. A lot of times people hear of neuromuscular therapy as being a very deep, aggressive therapy, and it doesn't have to be. So we're looking for areas of ischemic tissue, and then the next component that we want to look at is trigger points. Okay? A lot of times when a muscle gets so tight, it develops a trigger point, and it'll send pain somewhere distant to where the knot is. Okay? Basically, when a muscle tightens up too much, becomes ischemic, and if it's there long enough, it develops a trigger point that can send pain from, say, underneath the head to the top of the temple, or into the eyebrow, or into the cheek. Okay? The muscle is here where the problem is, the pain is referred to a distant area. Okay? And then your third component is trigger points, and that needs to be treated specifically with ischemic compression to release the soft tissue. And typically with trigger points, you want to hold them until the muscle relaxes. But again, proper pressure will help alleviate the pain. As the muscle releases, the pain melts away. So we talked about posture, range of motion, ischemic tissues, trigger points, and then your last and 5th component of neuromuscular therapy is soft tissue nerve entrapment. Soft tissue nerve entrapment means where the muscles or soft tissue is pressing on a nerve that can cause numbness and tingling or dysfunction. So the scalene muscles in the side of the neck can entrap the brachial plexus, or the pectoralis minor can press down and cause numbness and tingling. So the problem in the soft tissue entrapping the nerve here in the pectoralis minor can press right on that nerve as it exits down into the arm, and then you get numbness, tingling down the arm. So again, neuromuscular therapy is going to address those dysfunctions of the soft tissue and its role in causing pain and dysfunction. If you'd like to learn more about these techniques, sign up for our free newsletter and read our blogs on our website. Thank you.